Hi guys, so today we're going to do the humerus. The humerus is really important because it's a pretty lengthy bone. It has quite a lot of bony features. My name is Dr. Ishil and I will be guiding you through this essential topic on the humerus. Now, first and foremost, the humerus is the longest and strongest bone in the upper limb, playing a very crucial role for movement and support. Basically, let me take my pointer out from this. Okay, so basically, the overview of the session is that we will cover various aspects of the humerus, which will include its classification as a long bone, why it's called a long bone, its different parts, how to determine its side. Whenever we give a viva for the anatomy, first of all, when we take the bone, we have to identify which side of the body it belongs to. Does it belong to the right side of the body, or does it belong to the left side of the body? And detailed descriptions of its anatomical features, such as borders, surfaces, tubercles, and fossae. So by the end of this lecture, you should have a strong foundational understanding of this bone. Attachments will not be covered in this lecture, that they will be covered in the part 2 of this video. So the humerus, right? So the humerus is the arm bone. It's a type of long bone. Since we say that it's a type of long bone, we know that it has a shaft and 2 expanded ends. Now it articulates proximally at the shoulder joint. We studied that the scapula has a glenoid cavity or the glenoid fossa, and it's as a lateral angle of the scapula, and that glenoid fossa articulates with this this head of the humerus in the glenoid cavity, right? So it forms a ball and socket joint with that glenoid fossa for the shoulder joint to create the shoulder joint. It articulates proximally at the shoulder joint and distally with the elbow joint. So distally, this part articulates with the radius and ulna, which are bones of the forearm, namely. Moving on, we can see this here and shown as in the images. There's an upper end, there's a lower end, and there's a shaft. So whenever we say that something is a long bone, we know that it has a shaft, and the shaft expands at the proximal and distal ends to form the upper end proximally, and then here it's forming 2 condyles and then epicondyles and then ridges that we will study later. Okay, so this is the lower end and this is the upper end. This is the anterior view, this is the posterior view. All right, moving on. Now, whenever we talk about a bone, I told you that we will always see which side of the body it belongs to determine whether humerus belongs to the right side or the left side of the body. To be able to do that with confidence, follow these pointers that I'm about to tell you, right? So the head of the humerus is directed medially and backwards, right? The upper end is rounded to form the head, and the lower end is flattened from before backwards. Whenever we say something is flattened from before backwards, if you feel it like this, the lower end will be flattened, and the upper end is cylindrical and round. The medial epicondyle, which is always a little more pointed than the lateral one in the humerus, will exactly tell you that this is the medial side. So that's how you know that this is the medial side, not the lateral side. Another thing that you have to know for the humerus is this very important fossa at the back. This is the this is a very important fossa. It's very easy to appreciate this because it's like a proper depression that you can see at the posterior side of the humerus. This is the olecranon fossa. So how to know which side of the body this bone belongs to? First of all, I will see the bone. I will see, oh, which side does the fossa belong to? So the fossa is on this side. I'll say, oh, so this is the posterior side. I can also say that where is the head pointing to? So the head is directed medially and backwards. So I know that this is the medial side. Another thing I can see is, oh, how do I know this is the medial side or the lateral side? We'll see the medial condyle. Where does the medial epicondyle uh, where's the medial epicondyle on this bone? It's here. So I know this is the medial side, right? So I know the head is upward and medial. I know that the medial epicondyle is obviously by its name medial. The olecranon fossa is present posteriorly. And another thing is the lesser trochanter. Can you see this trochanter here or the tubercle here? We call this the lesser tuberosity or the lesser tubercle. It's literally anteriorly present and it's very rough and ridgy when you feel it, right? So this is the lesser trochanter and this is the greater trochanter. So this is the greater trochanter, this is the lesser trochanter. The lesser trochanter is present on the anterior surface. Okay. So just a heads up on some extra information on the medial epicondyle. It is 15-degree tilted backwards. Yeah, a little bit like this. All right, moving on. We'll talk about the head of the humerus here. Now, when we talk about the head of the humerus, there's some important landmarks that you should know. This is the lesser trochanter and this is the greater trochanter. And in between these two trochanters or tuberosities is the intertubercle sulcus, right? The intertubercle sulcus. Now, when we study the head, we can see that there is a shallow line. Can you see this? There's a line that covers just the head part, right? So this is the anatomical neck of the head. Can you appreciate that? So this is the anatomical neck, right? But when I hold the bone in its actual position, and there's a literal demarcation here. I'll show that to you as well. Can you see this line here? This one. So it goes all the way around. This is the surgical neck. So there's an anatomical neck that is literally here, and the surgical neck that is literally here. So we have two kinds of necks when we talk about the head of the humerus. Now we have two tuberosities, the lesser tuberosity and the greater tuberosity. The greater tuberosity is very important because it has three facets. Can you see this greater tuberosity? It has three facets, three impressions. We can appreciate them here. Look at this. So there's a upper impression, a middle impression, a lower impression, or facets. And why are they important on the greater trochanter? Because three very important muscles that we'll study have their attachments on these three facets. Okay. Okay, moving on. Now we have some important borders that we should know. First of all, we need to know the anterior border, right? So the anterior border of the humerus, it extends from the greater tubercle. This is the lesser tubercle. This is the greater tubercle. So it extends from the greater tubercle at the top to just above the coronoid fossa. Now, can you see that there's a fossa here? This is called as the coronoid fossa. So we have the coronoid fossa at the anterior side in the lower part and the olecranon fossa at the posterior side. So you can feel that there's a border, a line running all the way from the greater trochanter and up until the coronoid fossa. And this is our anterior border. This border helps separate the anterior medial surface from the anterior lateral surface. So obviously, when I'm talking about the anterior border that extends from the greater tubercle all the way to the coronoid fossa, I have an anterior medial side and I have an anterior lateral side, right? You can even appreciate that here. I will show it to you here. Please appreciate this this yellow border extending from the greater tubercle going all the way to the coronoid fossa is dividing the humerus into two surfaces, the anterior medial surface and the anterior lateral surface. So in this is the anterior medial surface and this is the anterior lateral surface. You can appreciate that here, right? Look at this. This is the continuation of the crest of greater tubercle. When we talk about the crest, we're talking about the highest point on that tubercle. And then it's going all the way to the coronoid fossa. You can appreciate the coronoid fossa better here, right? And then we have, so this is the anterior border. I hope it's clear now. Then we have a lateral border. Please appreciate the blue line here. The lateral border of the humerus starts from the posterior aspect of the greater tubercle. So we can see that this was the greater tubercle, this was the lesser tubercle. Now in the greater tubercle, there's a posterior aspect as well. Posterior aspect of the greater tubercle and extends down to the lateral epicondyle, right? The lateral epicondyle. We studied that this was the medial epicondyle, so this is the lateral epicondyle. So from the posterior aspect of the greater tubercle, we follow all the way to the lateral epicondyle, and this is our lateral border. Now, what is the importance of the lateral border? It separates the anterior lateral surface from the posterior surface. Obviously, the side on which there's the olecranon fossa is the posterior surface. And this part, the anterior lateral surface, both of those surfaces are separated by the lateral border, obviously. The spiral groove, a shallow oblique depression, is present in the center of this border and serves as a pathway for the radial nerve. if you follow this lateral border from the posterior aspect of the greater tubercle all the way to the lateral epicondyle, you can see that there is a spiral groove here. Can you appreciate the spiral groove? The spiral groove is, it acts, so this is the synthetic bone, but on the real bone, it shows up as a shallow oblique depression. And it is present at the center of this border and serves as a pathway for the radial nerve. All right, I really hope that's clear now. I really tried hard, guys. Okay, moving on to the medial border. Now, the medial border extends from the lesser tubercle. You know that the lesser tubercle is literally on the anterior side. This is the lesser tubercle. The medial border literally starts from the lesser tubercle, which is the easiest tubercle to spot on the humerus because it's literally in the front, right? Just on the anterior side. So you start from there for your medial border. You start from the lesser tubercle and you literally go all the way to the medial epicondyle. And that's your medial border, right? So the lesser tubercle all the way to the medial condyle is your medial border. The upper third of this border forms a ridge known as the crest of the lesser tubercle. So you can, this part that all the way we're going down from the lesser tubercle, this is the crest of the lesser tubercle. The lower third forms a slight ridge, this ridge, called the medial supracondylar ridge. This ridge is called the medial supracondylar ridge. Why is it important? Because it serves as the attachment point for some very important muscles of the forearm, right? Moving on to the surfaces of the humerus. Okay, so we've done the lateral, we've done the lateral border, anterior border, then the lateral border, and the medial border, right? So we've done 3 borders of the humerus. Now we'll do the surfaces of the humerus, right? When you talk about borders, borders will always divide a bone into surfaces. Now, first of all, the humerus has 3 primary surfaces, right? First, we'll see the anterior surface. Anterior surface is further divided into 2 surfaces, as we studied before, an anterior medial surface and an anterior lateral surface, right? We can even appreciate that in these images, right? So please appreciate it in these images, because I don't think the bone, the surfaces will be very easily demarcated on the bone I'm holding. So you can appreciate that this yellow border was the anterior border. Where was it starting from? Does anyone remember? So the greater tubercle all the way to the coronoid fossa, right? So that divides our anterior surface into 2 further surfaces, and the anterior medial surface here and the anterior lateral surface. Now on the posterior side, we can see that the lateral border, we were starting from the lateral aspect of the greater tubercle all the way to the lateral epicondyle, was separating the anterior lateral aspect from the posterior surface. So here you can appreciate the posterior surface, right? And then where does this end medially? Where does the posterior surface end medially? At the medial border. And the medial border was starting at the lesser tubercle and continuing all the way to the medial epicondyle. You will, when you follow the borders on the bone, you will see that they are slightly curved from the top to the bottom, right? All right, so this is a little revision of the tubercles. Here we will appreciate them a little bit better. The greater and lesser tubercle are prominent here, the greater tubercle and then the lesser tubercle, right? The lesser tubercle is literally in the middle, in the front. It is very easy to appreciate it. The structure is present on the upper end of the humerus, and the greater tubercle located a little laterally here. You can see it serve as attachment site for 3 muscles, right? Which muscles are these? They are the supraspinatus, infraspinatus, and teres minor. So you can remember it as the mnemonic sit, right? Supraspinatus, infraspinatus, and teres minor. The lesser tubercle, located more anteriorly, this one, provides the attachment for the subscapularis muscle. So the greater tubercle is supraspinatus, infraspinatus, and teres minor, and this lesser tubercle attaches the subscapularis muscle. The other attachment was at the subscapular fossa at the scapula, if you remember it. Moving on. We've studied these borders and surfaces. I hope this image is a good revision for you guys. Moving on. The tubercles, we've already studied the greater tubercle. This had 3 facets, which were bearing the attachments of the supraspinatus, infraspinatus, and teres minus with 3 impressions here, right? Now, here you can see that the greater tubercle has 3 impressions. Here you can see this supraspinatus attaches to the posterior part of the tuberosity. The teres minor attaches to the posterior inferior part. And this, the supraspinatus attaches to the most upper part, the most anterior part. And then the posterior part is attaching the infraspinatus, and then the teres minor is attaching the posterior inferior part, right? So SIT. So this is the supraspinatus, infraspinatus, teres minor, right? And then the lesser tubercle is attaching the subscapularis muscle, right? So the lesser tuberosity is insertion of the subscapularis muscle. You can see this is the lesser tuberosity. Now we have another bony landmark here, which is called the trochlea, right? So can you see this pink area? This is the trochlea. We can even appreciate the trochlea on this part. So this is the trochlea. Why is the trochlea important? Because it articulates with the proximal ulna at the elbow joint, right? The trochlea is a spool-shaped structure that articulates with the ulna, while the capitulum, which we will see now, the capitulum is a rounded structure that articulates with the head of the radius. Now you can see that there's a capitulum here, right? This articulates with the head of the radius at the ulna joint. You know that the radius is on the lateral side. We always check our radial pulse near the thumb, right? We always check our radial pulse near the thumb, right? So the radius is on the lateral side. So the capitulum articulates with the radius, so it's on the lateral side, okay? And it's a rounded structure. These structures, the trochlea and capitulum, both contribute to the hinge-like movement of the elbow joint. Now let's appreciate the elbow joint a bit. So you can see the trochlea is here and the capitulum is placed a little laterally. The capitulum is articulating with the head of the radius and the trochlea is articulating with the ulna, right? And this entire elbow joint is contributing to the hinge-like movement, the flexion and extension, the hinge-like movement of the elbow joint, right? Moving on, we should appreciate the 2 fossas here. When we talked about fossas and bony landmarks, we said that they're depressions basically. But you will always see that the olecranon fossa on the posterior side is very, very deep compared to the coronoid fossa on the anterior side. The coronoid fossa articulates with the coronoid process of the ulna, and the olecranon fossa articulates with the olecranon fossa of the ulna. So both these fossas articulate with the ulnar, okay, with the ulna bony landmarks that we'll study later. I don't remember now. So the ulna has like this bird-shaped notch that sort of goes like this. So one part of the ulna will articulate with the coronoid fossa on the anterior side, and one part of it will articulate with the olecranon fossa on the posterior side. So both of these attach the give joint-like attachments to the ulna, right? So these are the fossa that are present on the distal end of the humerus. The coronoid fossa is located anteriorly and medially, accommodating the coronoid process of the ulna during flexion. And the radial fossa, we haven't studied the radial fossa yet. So let's just stick to the olecranon fossa and the coronoid fossa yet, right? Okay, now there's another fossa. Now this is called the radial fossa. The radial fossa is really small. Can you see that here? So what is the radial fossa doing? The radial fossa located anteriorly and laterally. I told you whenever we're talking about the radius, we're talking about it being lateral, right? So the radial fossa located anteriorly and laterally accommodates the head of the radius, and the olecranon fossa we've done is present here posteriorly, and receives the olecranon process of the ulna during elbow extension, right? So this is the radial head which articulates with the radial fossa. This is the radial fossa, sorry, that articulates with the radial head of the bone in flexion of the elbow. Okay, now there's an important groove. We're not doing the attachments yet, but since this groove is really important, I want to touch it with you guys. So there's a bicipital groove right? The bicipital groove, also known as the intertubercle sulcus. So can you see where my finger is? Between the lesser tubercle and the greater tubercle, there's a sulcus that is literally fitting my finger here. This is called the bicipital groove. Why is it important? Because it's a narrow groove located between the lesser and greater tubercle, and the long head of the biceps brachii tendon runs through this groove, and the latissimus dorsi muscle attaches to its floor. So the floor of this fossa attaches the latissimus dorsi muscle, and this sulcus lets the tendon of the biceps brachii tendon, um, this sulcus lets the biceps brachii tendon run through it, and the floor gives attachment to the latissimus dorsi. Can you please see that here? So this is the long head of the biceps tendon that originates from the superior rim of the glenoid of the scapula. So from the superior rim of the glenoid of the scapula, the long head is coming. It's passing, and it's passing through the shoulder joint and entering the bicipital groove here, right? So it's passing, it's not attaching, it's passing. And the latissimus dorsi attaches to the floor of this bicipital groove. Now, this same bicipital groove also gives attachment to the lateral, to the pec major, the pectoralis major muscle. It attaches to the lateral lip of the bicipital groove. The latissimus dorsi attaches to the floor of the bicipital groove, and the teres major attaches to the medial lip of the bicipital groove. So, if I hold the humerus like this, in its actual position, since this is the left side of the humerus, we have the lesser tubercle here. The head is pointed medially backwards. This is the greater tubercle. This is the sulcus. Now, this is the sulcus, right? So medially, most medially, we have the teres major attaching to the medial lip of the bicipital groove. Please appreciate in the image also. Then the floor gives attachment to the latissimus dorsi, and then the lateral lip, the most lateral part, gives attachment to the pec major, the pectoralis major. Gives attachment to the lateral lip of the bicipital groove, right? This is why the bicipital groove is important. It's really important. Moving on, there's a mnemonic for muscles attaching to the bicipital groove. It's called a lady between two majors. So the lady is in the middle, the latissimus dorsi is in the floor, it's in the middle. And then the teres major is present medially, and then the pec major or the pectoralis major is present laterally. So, and what's running in the groove? The tendon of the biceps brachii tendon, right? Okay, condyles, just the condyles left. Attachments I'm not going to cover in this video. So you can appreciate that the origin of the biceps brachii is from the tip of coracoid process of scapula and the supraglenoid tubercle of scapula. Basically, there's a short head, there's a long head. The long head basically passes through the bicipital tendon, but the short head comes directly and attaches to the tuberosity of radia and fascia of forearm. Now you can see it here also. So this is the long head, this is the short head, and this is the bicipital groove. You can also appreciate it here. Here's the bicipital groove, right? Okay, now just the last thing, the condyles. Now the condyles of the humerus, when we're talking about the condyles of the humerus, we have the medial epicondyle, which is very prominent, right? It's very prominent, the medial epicondyle. The distal end of the humerus contains two condyles, the lateral condyle here. Can you see this here? The lateral condyle and the medial epicondyle. The lateral epicondyle and the medial epicondyle. So the medial epicondyle is very important because it gives attachments to a lot of muscles. You can see that it gives attachments to these 5 muscles that we're not going to cover right now, right? We're going to cover the attachments in the next video. But this is the medial epicondyle, and it's important because these structures serve as attachment points for ligaments and muscles and contribute to the joint stability. Which joint stability? The elbow joint. Now, coming to the lateral epicondyle is much shorter and much less appreciated than the medial one, but it gives attachment to another extensor. Why are we saying common extensor region? Because most of the muscles that are attached here are all extensors. They extend the elbow, and all of the muscles attached on the medial epicondyle are all flexors. So they flex the elbow, okay? So let's just go over the elbow joint a little bit. The elbow joint is basically the distal end of the humerus, and it plays a crucial role in forming the elbow joint, this distal part. The articulation between the trochlea and the ulna allows hinge movement, right? So like a door opens, it opens on a hinge movement, right? So this allows the ulna to carry on hinge movement while the capitulum articulates with the radius to allow rotational movement of the forearm. This joint is essential for flexion and extension of the arm. Now, just to summarize a little bit, the humerus is a long bone that plays a vital role in upper limb function. We have discussed structure, head, borders, surfaces, tubercles, fossa, and condyles. Understanding these features is essential for clinical application, particularly when addressing and watching fractures in X-ray and joint issues, joint movements. I really hope that you get the side determination correct, because if you get the side determination correct, everything else follows after that. You know, if the entire bone just follows after the side determination is correctly placed. And even when you're giving a viva or you're explaining a bone in an SEQ, once you get the side determination correct, literally everything else follows. And that's like your major chunk of the marks that the examiner is going to provide for you. All right. Thank you so much. This has been really nice.